Today, I'm outlining the third plank of my Build Back Better program, mobilizing a 21st century care and elderly childhood education workforce to deal with the caregiving crisis, and it's a crisis in this country. If we truly want to reward work in this country, we have to ease the financial burden of care that families are carrying. We have to elevate the compensation of those providing the care, the benefits and dignity of caregiving workers and early childhood educators. Even before the pandemic, millions of working families are faced with enormous financial and personal strains trying to raise their kids and care for their parents or loved ones who are living with disabilities. This is the so-called sandwich generation. Includes everyone from an 18-year-old daughter caring for her mom who suddenly gets sick to a 40-year-old dad raising his child and caring for his own aging parents. The joy and love are always there, but it's hard. I know it's hard. It's really, really hard. Families are squeezed emotionally and financially. They need help, but too often they can't afford it. And the professional caregivers out there, the home health care workers, child care workers, or more often women of color and immigrants, are too often underpaid, unseen, and undervalued. The pandemic hits and squeezes and tightens on everybody. Nursing homes have been hit hard. If you're a frontline worker, you struggle to find safe childcare for your kids. Others of you have become unexpected 24/7 caregivers, trying to keep your children safe and learning while you continue to work remotely from home. If you had to put your career on hold indefinitely or seen your hours cut or your job lost, the confusion over school reopening only makes things worse. You know, in the last few months has only underscored how vital it is for families and older Americans to have more home care and community care choices that fit their real needs. You know, we're trapped in a caregiving crisis, within an economic crisis, within a healthcare crisis. You're doing everything you can, but this president is not. If I'm your president, here's what I would do. First, let's start by caring for aging relatives and loved ones with disabilities, helping them live independently. Here's an example. Right now, there are 800,000 people who are eligible for home and community care through Medicaid who've already signed up for it. But they're waiting for a phone call back. For some, the wait is 5 years. 5 years. My plan makes a bold investment so states can clear the waiting list. To make sure we ease the financial burden for more families going forward, we have to make long-term federal investments. We'll have a major innovation fund that allows states to test and expand successful ways to improve home and community care and increase prevention and reduce the cost of hospitalization.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.